caring for sick and injured people with the few resources available. Last week, he recorded an urgent video message, fearing the imminent destruction of the hospital and the end of his ability to provide the care. He asked for international intervention to stop the violence. He called for peace. We got to know Dr. Abu Safiya over the past few months. We have been in constant touch with him. What is striking about him is his extraordinary composure, his kindness, his unwavering dedication, even in the face of unimaginable hardships. We have known him to be brave, dedicated, professional, and most of all, very gentle, with gentle manners that exuded every time we spoke to him. We invited him several times to join us on webinars and phone calls to speak to us, to get his message to the world. Unfortunately, we did not succeed, and we are now terrified for his fate because he is now in the hands of the Israeli forces. We are terrified for his fate, knowing all too well the horrors that await our doctors as Palestinians in the torture camps in the Israelis. We have been appealing to medical leaders, and we even wrote a letter that was delivered to President Trump to save Dr. Abu Safiya and save Kamal Adwan, but we failed. And the IDF stormed the besieged hospital, burning it and arresting healthcare workers on December 27th. There is no way that this is acceptable in any universe. We appeal to world leaders, to the global medical community, and to all those who value humanity. Please help us save our friend, our colleague, and a true healer. Put all kinds of pressure to ensure his release so he can return to his patients who need him desperately, and to his family who cannot endure this pain. We demand a reality that respects life, respects human rights, and respects every man, woman, and child. Alia?
Thank you. We believe that every life is sacred and precious, and we are representing more than 10,000 physicians and healthcare workers in North America. We are demanding the immediate release of Dr. Hussam Abu Safiya and the staff at Kamal Adwan Hospital in Gaza, and the immediate restoration of healthcare to the people of North Gaza. Over the past 448 days, more than 14 months, we have watched a live-streamed genocide with no meaningful global response. We have seen more than 200,000 people have been killed, mostly women and children. And now more than 2 million people are being starved to death. Children are being specifically shot in the head and chest and burned to death and blown to bits by the continual, indiscriminate bombing of hospitals, schools, refugee camps by Israeli forces. This is unprecedented cruelty. International monitors and journalists have been denied entry into Gaza. In fact, journalists have been targeted and killed. The healthcare workers and the healthcare infrastructure is being systematically destroyed. Doctors are being targeted and illegally kidnapped and tortured to death. And now we see the director of the last partially functioning hospital in Gaza has been detained by Israel. Israel claims that all targeted personnel are Hamas operatives, but prevents entry of any international monitors into Gaza to investigate this allegation, and continues to bomb all the hospitals, schools, and universities, as well as water wells and sanitation facilities essential for life. And it does this with impunity. It is essential for a civilized society to follow law and order. The Geneva Convention forbids the bombing of hospitals and targeting of healthcare workers or children or civilians. Earlier this year, we saw Dr. Adnan al-Bursh was kidnapped by Israeli soldiers. He was brutally raped and tortured to death by Israeli forces. This cruelty must end. Canada must demand respect and upholding of the rulings of the International Court of Justice and the International Criminal Court, and urgently demand protection of all civilians, provision of humanitarian aid, and the immediate release of Dr. Abu Safia and all healthcare workers and patients illegally kidnapped by Israeli forces. Over to you, Catherine.
Thank you, Alia. In the 14 months since the 7th of October 2023, hospitals and healthcare facilities have not been spared by the Israel Defense Force. They have been targeted. Of the hospitals in Gaza, 17 of 36 are not functioning. The unlawful denial of medical supplies and the unlawful killing of healthcare workers severely limits what work can be done in the surviving sections of hospitals and healthcare facilities. Every aspect of healthcare is made more difficult by the shortage of food and clean water, by the malnutrition and communicable diseases that are highly prevalent. Severe shortage of standard medications for chronic health conditions like heart disease, diabetes, and cancer causes further preventable civilian deaths. And because of civilian bombardment day after day, healthcare workers also have to manage the civilian victims of violence. Many of these casualties are children. Healthcare workers returning from Gaza report that often 80 or 90% of the casualties received after a raid or a bombardment are children. They see children who die at the site of the attack. They see children who die in ambulances, 5 to a gurney. They see children die under their own helpless hands immediately after arrival, and they see children die slowly over the days and weeks that follow without pain control, antibiotics, or nutritional support. It is always illegal under international law to target children and places where children congregate. Closing and destroying hospitals is a significant milestone in the path to ethnic cleansing. Remaining hospitals are beacons of hope to the suffering people of Palestine. The destruction of hospitals leads to the loss of that hope. We are all failing the people of Palestine when we allow hospitals to be destroyed without speaking out. Over to you, Nidal.
You're muted.
I think you might be muted, Nidal.
Thank you. Good morning. Good morning, everyone. Doctors Without Borders, Amnesty International, and Human Rights Watch have joined Doctors Against Genocide, countless institutions, and leading genocide scholars in recognizing and declaring the atrocities in Gaza as genocide. No genocide in history has stopped on its own. The state committing genocide always perceives itself as justified in its actions. Palestinians are being systematically violated in plain sight, while Israel has dehumanized them to the extent that Palestinian lives are deemed expendable. The survival of the Palestinian people is at imminent risk. This genocidal campaign is designed to impose conditions of life calculated to destroy the Palestinian people in whole or in part. Rational appeals and quiet diplomacy have utterly failed. The perpetrators of genocide do not respond to reason or moral persuasion. Outside intervention is essential to halt this mass slaughter of innocent lives. We demand the following. Number one, an immediate end to all hostilities targeting medical facilities, healthcare workers, and civilians. Number two, the unconditional release of Dr. Hussam Abu Safia, his colleagues, and all others illegally detained. Number three, unrestricted humanitarian and medical access to Gaza, including the safe passage of aid workers. Number four, an immediate halt to military and financial support to Israel by the United States, Canada, and other complicit states. Number 5, comprehensive boycotts of Israel and all entities complicit in this genocidal campaign. Number 6, the urgent deployment of international peacekeeping forces to protect children, civilians, and healthcare workers, and to prevent further mass atrocities. No genocide in history has been stopped by negotiations alone. It takes decisive action from the international community to intervene and impose justice. Negotiations alone, it's like asking the victims of the Nazi regime to negotiate a better outcome with their aggressors. The world did not accept it then and intervened. The world should not accept it now, and it should intervene with force to protect the victims of this genocide. Every day of inaction results in the loss of hundreds of lives, the starvation of millions, and the obliteration of basic human dignity. The sanctity of life must be upheld, and the genocide in Gaza must be stopped now. The time for words have passed. Now is the time for action. History will judge us by how we respond to this moment of profound human suffering and injustice. Thank you.
Thank you very much. If there are any questions or if any of the media would like to have any interviews, then we are available for interviews. And Yasmin, you're available for media to connect with you, right? Yes, Yasmin is on. Okay, thank you very much, everybody, for
Somebody raised their
joining.
hand. I think it's a media contact. Gur,
Oh, okay.
I'm gonna allow you to talk.
Gore, would you like to go ahead?
Gur, you can speak now. You just have to unmute yourself.
Gore, you're still muted. Oh, Yasmin said she's not able to unmute herself, by the way. And Yasmin said she's available for any media requests and that that information was included in the press release. Thank you, Yasmin.
Gur, we're not able to hear you. Maybe I can connect with you later. I have Gur's contact.
Perhaps you could put your question in the question and answer.
Yeah.
That's a great idea.
Can you unmute them, Maisa?
I can't unmute him. He will have to unmute himself, but he's not unmuting himself.
Or bring him as a panelist, I think. Maybe that's
He
the
is.
only way.
He's.
Oh, he is?
I brought him up as a speaker.
Okay.
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 All right.
We can always get his questions later.
Yes. If there are any questions, people can put them in the chat and we're happy to address them.
Thank you, everyone.
Thank you so much, everybody.
Thank
Please
you all for
connect with
coming.
Yasmin if you would like to connect with